So guys, before this video starts, I just want to say a huge thank you to everyone who has been subscribing, supporting this channel and liking the videos because we have recently just hit 300 subscribers. So we are on our way to 500. Hopefully we'll get it this year. If you are new to this channel, hit the subscribe button right down there. In this video, I explain how caries progress throughout your teeth, and I explain a little bit of a story / dramatic method. So I hope it will interest you guys. I want to try out something new. So hope you guys enjoy it, and let's get into this video.
Caries, our doom, our destruction. For years, humanity has suffered from this heart-wrenching, unexplained phenomenon. Our teeth crying for help every day, saying, please do not kill us, do not do this to us. But us, savage human beings, we do not care about how we treat our teeth, and we let them die every single day. Well, that was a bit of an intense intro, but I think it was needed because today we're going to be talking about the progression of caries and how it affects our teeth as we go along. So I'm going to be telling this in a semi sort of story form or in semi-explanatory form. So hope you guys enjoyed this video. If you haven't yet, subscribe right down there, and let's get into this video. Stage 1. This is the beginning of the end. What you will witness is chalky white areas on your tooth. This is because of the loss of calcium and the buildup of plaque. Your arch nemesis, bacteria, starts to build up in these areas. And what do? They break down carbohydrates into acids. And these acids break down the external tooth structure known as enamel. This process can be reversed if you go to a dentist immediately, and they will probably prescribe you something such as a fluoride varnish or whatever, and this will improve it and bring your tooth back to normal. But for the sake of this story, let's say you aren't that responsible and you haven't been to a doctor and you've let it progress further to stage 2. Stage 2. Oh hell no! This is when the enamel starts to properly break down. The acid produced by the bacteria starts to become so much that the enamel, which is the hardest substance in the body, starts to break down. At this point, you can't really recover the enamel by remineralization processes, but the tooth has weakened, it's losing the battle, but we still have not lost the war, and you must now rush to your savior, the dentist, so they can help you out and still save the tooth from being lost. But let's say for the sake of this video, you still don't go to the dentist. You say, I do not even need a dentist, and you chill at home and let it progress further. What happens next is shocking. The caries has reached the dentin layer, which is much softer than the enamel layer. And being much softer, do you know what that means? It means that the caries and the bacteria are able to invade your tooth structure much faster, and it's able to progress faster and faster and faster towards the pulp, the center of this kingdom that the bacteria is trying to attack. At this point, a dental filling will be required to fix the damage that has been caused by the caries. Stage 4. At this point, if you haven't gone to the dentist, I really do not know what you're doing, because here's what happens next. The tooth pulp is the center of your tooth, the castle of this kingdom, which contains all of the blood vessels and nerves that innervate your tooth and provide it with the nutrients that it needs to live. But guess what reaches the pulp? Your worst enemy, caries. The caries rapidly passes through the dentin and enters into the pulp, and once it is inside, it causes many diseases and problems such as tooth abscess or pulpitis. Bulging, yellow, rancid pus starts coming out of the abscesses that form in the gingiva, and the pain is unbearable. The war is lost, the castle has fallen, and the tooth needs to be extracted. So guys, I hope that you did enjoy this video. If you did, be sure to give it a thumbs up and share it with whoever you think this will help out, just to raise some awareness. I try to make it as interesting as possible. And if you haven't done so yet, hit that subscribe button, because we're trying to get to 500 subscribers this year and we're already nearly at 300. So every little bit helps. Thank you for watching. I hope this video was educational. My name is Future Dental, and I'll see you guys in the next video. Doobie doobie doo badoo, be doobie doo badoo, be doobie doo badoo. John Cena.